to live a healthy life.
Yeah, yeah. Where does she get her information from? Do you watch TV with her?
And you're not wearing a mask at home. All of these things that we find in African Americans increase your susceptibility to getting the virus, especially this more contagious Delta virus. Right now, in hospitals throughout the country, but most certainly in the South.
What happens if it's positive? You do not want to take the risk.
You need to ask those questions.
What made you come?
I came because I wanted to get vaccinated so me and my family won't have COVID.
Hi, this is Dr. Lenore Coleman, president and founder of Healing Our Village. Welcome to For Your Health. Right now, as you know, we've been doing a lot of things on diabetes and kidney disease, and we've actually done a few things on COVID-19. All of that is on my website, HOVhealth.com. And it's on video on demand. I've got doctors from the Atlanta Medical Association. We've had physicians from California and here in Atlanta talking about COVID-19. But now, every Saturday, I'm going to try to focus on what I'm calling COVID conversations. So I need to talk to people who got the vaccine and people who are not going to get the vaccine so I can figure out exactly what's up, what's the deal. I need to have a conversation with the folks that took it and the folks that are not taking it so that we can make sure that the information that everybody's using to process their decision about vaccination, no vaccination is at least accurate. You know, I don't really care what you do, right? That's as people say, oh, this is a personal decision. You know, I don't have to necessarily want to have to take the vaccine if I don't want to. And you are absolutely right. But you don't have the decision to infect me. That's the problem. So I need to have a conversation with you because I'm interested in trying to get back to my life being normal. And my life normal means I don't need to have to wear a mask. And so this is my problem. Okay, because this masking is really getting me down. I've been doing this whole mask thing for over a year, and I'm tired of wearing a mask. I am way too cute to be having to wear a mask. Okay, I need to be able to smile at people, and I need to be able to see what people talk about. I don't hear that good, and I can't hear what folks is talking about through that daggone mask. Okay, so one of our guests for this week is Kevin Toney, and I've known Kevin forever. Kevin Toney is, for those of you who may not remember, Kevin Toney used to be Kevin Toney in the Blackbird. So I'm going way back in the day. That's way back in the day, y'all. And I used to party to Kevin. I've known him. He used to, when I lived in Cali, because I'm a LA girl, when I lived in Los Angeles, Kevin and I did some work together with some fundraisers. He did a couple of my fundraising, art and jazz. And so I've known Kevin since then. And Kevin not only is a musician and a producer, but he also has his own men's group where he actually is promoting messaging and mentoring for men. So we're going to talk about that, Kevin, because I think that's amazing. So I just want to thank you for coming over here today. This is one of my first COVID conversations. And you can sort of tell me what you're thinking about, what you're hearing, what's out there in the village. Why you made the decision to take the vaccine. But before we do that, I wanted you to just kind of tell people who you are, what you're doing, what you're up to, because I want to make sure that we represent, you know?
First of all, Lenore, thank you for having me on your program. Any program you do, I'm just delighted to be on because I love, appreciate, and support all of the facets of good health for our community. It is so important. So first of all, thank you for letting me be here. And yes, we've known each other a while, and that's a very good thing. You know, and I consider you my friend.
Yes.
It's interesting, and I'll talk about that later about one of your classes I'm taking. But you know, look, I'm from Detroit, Michigan. I'll just give you a little gist. I'm from Detroit to Motown. Okay. And I've really been a musician pretty much all my life. I, started playing piano at 5 and through high school. And, the only two jobs I had that weren't musician related was I worked in a shoe shop for about 6 months. That didn't last long, and I had a paper route. Other than that, those are the only two jobs I've had. Everything else since age 12, I've been blessed to
Okay.
make money, and of course, living from music. Now, as you mentioned too, some of your people checking out the show would know me from my work with the Blackbirds. I'm one of the, not only was I'm Kevin Toney in the Blackbirds, I'm Kevin Toney, one of the founding members of the group. And yes, we had the distinction of being full-time students at Howard University, um, making records, traveling around the world, being out there on the set, you could call it, you know, but professionally speaking, we were full-time students making records, making history,
Love
making
it.
hits.
Howard, you
Um,
know, hey, you.
and HU, you know, we got our good vice president from there, putting us on the map further. Kamala Harris, God bless her. But Donald Byrd, so to give all respects to him, he was our teacher at that time and mentor and producer, and he really put the group together and gave us that opportunity that's set the stage for everything I do musically from that point. You know, these days. You know, moving fast forward, I am a recording artist as well. I've got over a dozen records out. So anyone wanting to check out my music and my body of work, which is a pretty large body of work over the last 4 decades, please go to my website. You know, that would be the best way to get to find out about Kevin Toney and his music. So that's that. I also want to share with you as a musician, I'm always delighted to share that this year me and my wife will celebrate 42 years of marriage. And praise God for that.
Praise God.
In the entertainment business, that might, you have to add another 10, 15 years on there. So we've
Yeah.
probably been married at 55.
Okay. Not easy.
And
It's not easy, especially
not
back in
easy,
them early days, huh? When you were traveling and
especially.
stuff going on, and
And which brings up to a point about what you mentioned about my men's group and men's ministry. I actually, it's some of both. It's actually an outreach. I call what I do an outreach ministry because I try to outreach. I outreach to men and families, but particularly the men who have been struggling with infidelity, who have struggled with just being faithful, knowing how to be faithful. A lot of us just aren't taught that. It's
yeah,
just kind of like a lot of us aren't taught good etiquette for health.
right.
So a lot of us don't know and have to really be educated. Um, and the education it's a long curve,
Yeah.
especially when you lived a curve and a life based on what I call the men's code. I got a book called Breaking the Men's Code, The Virtuous Man. And look, the men's code, let's just talk quickly about that
Yeah, no, we got
because
to
it's
talk
another.
about it. Yeah.
Any reason or rationale that a man uses to have sexual or emotional relationships with anyone other than his wife or committed partner. So and usually we get this as men early on. We find out how to not have a good relationship or how to mistreat women. It might be from your father. It could be just from who you see in your neighborhood. It could be an uncle. It could be a teacher. It could be one of your idols, a sports person. So, as young men, we don't learn how to filter out the things we see. And some things we see that are cool, such as maybe mistreating your woman or just being disrespectful, that becomes a way of life. And we build on that. And it becomes baggage that we later carry into our relationships or marriages. I carried a lot of baggage like that because I had bought into this men's code. Anyway, long story short, I'll try to get you to the point of this, is that I want to have men follow the I can code. The I can be respectful. I can be faithful. I can be a soldier to my wife. I can be the best man I can be. I can be the best father. I can be the best husband I can be. And so that's the shift in paradigm that I not only challenge men, but I give them tools. I give them tools through my books. I've got two books. One book is, as I mentioned, called The Virtuous Man, Breaking the Men's Code. And that's just a book that book is two things. One, it tells my journey of how I got these men's codes or these misconceptions of why I thought it was so cool and okay to um, essentially mistreat and not have a good, healthy relationship
Yeah.
with anyone.
With anyone, yeah.
And then it talks about the steps, the practical and the spiritual steps that I took to break the code or to overcome it. And I talk about that journey, which was a 5-year journey at that time of just trying to peel off the old layers, et cetera, et cetera. And it's still an ongoing journey now in a good sense. And then I have a second book right now called it's called it's called Super Glue Your Love Relationship, Ingredients to Grow and Bond Relationships. And that's a book for both men and women to help, again, grow, super glue, bond your relationship. And they're great tools. And in those, I have tools, steps that a couple or a young man can use to improve their thinking, their outlook, and really have good relationships.
Yeah. That's the reason I brought you on, because I know about your work, and I just think it's fabulous. And part of what you do in your seminars is you're also talking to the guys about sort of being the head of the family, sort of leading the family. They're supposed to be the captain of this ship. That's what the Bible is basically saying, that these men are supposed to be leaders. They're supposed to be the captain. The wife's supposed, or significant other's supposed to be the first mate. And so they need to be driving this ship. So, this week I had a young man. He's in his 30s or mid 30s, and he got vaccinated, and he has a young child, and he could not convince his the mom of his child to get vaccinated. So now, the mom of his child and the new guy that's in her life, right, are all in the hospital right now fighting for their lives with COVID.
Oh, yeah.
It's crazy. So as families, this needs to be I hear all this. Well, I'm not going to do it, and I have my son is he monitors Facebook, and so yesterday he was showing me all these posts about girls. One young lady was on Facebook yesterday saying that if a man's gotten the vaccine, that's actually when she decides she's not going to talk to him no more, because she doesn't want to be with a man who's taken the vaccine, which to me, that's crazy. So I wanted you to talk about, I brought you on for those reasons, because, you are teaching our guys out there, our young guys especially, that they need to be stepping it up to the plate. They need to be faithful. They need to be heading the family. And this COVID-19 vaccination decision needs to be a family decision, because it affects everybody.
I do agree, and let me chime in on that now to bring us to the focus. My family and I got our vaccine together just about at the same time, and I got mine early on. There was no doubt in my mind after I read the information and with the virus, and at my age, and that I had to do it, and not only for myself. I needed to do it for the comfort of my wife, who I live with, right? And for my family, for my daughter, for my son. Like during COVID, I would have my daughter come over and sing every week. We did our music ministry from our home. So it was important that her coming in, that she had the right health etiquette about COVID, and that we had it too. So, we had a family consciousness about doing it. So when I got it, just a month later, my daughter had a friend who was able to hook up my wife, my son, and his wife. And so by April of this year, we were all fully vaccinated and were able to get together without the mask, and it was just a moment. It was so freeing. It was so and so the importance of, yes, I didn't have to really convince my family to do it, but I will say this though, to men, women out there, it's so important to do it. If you don't want to do it for yourself, then do it for your loved ones. Do it for your wife. Do it for your girlfriend. Do it for the people you work with. Um, you don't live in a vacuum unless you're living in a vacuum and you're not seeing anybody and you're not going out anywhere. If that's you and you're on a ship, on an island, you can do it. But if you're living in this world, it only takes really one instance for you to catch it and give it to someone else. And as we know now, we're here unless you're living in a cave and don't have any kind of technology, and you're not hearing the news about the Delta variant, that it affects people who even have the virus.
Right.
Your chances are much better. And not only that, probably first of all, is that most of the folks that are getting it, and these are not exaggerated numbers, this is not fake news, this isn't President Trump saying, hey, no, we won the election. No.
No. No.
Didn't win the election, just like this variant, most of the people that are getting it are unvaccinated. And so your chances of dying, first of all, are increased exponentially. And then your chances of giving it to somebody else, to me, it's a matter of no matter what your reason is, whatever your rationale. It's just like I was talking about the men's code, any reason or rationale you do something. At the end of the day, in the beginning of the day, it's selfish.
Right.
It's selfish because you're saying, I don't really care about, first of all, I don't care about myself is what you're saying, first of all. And that's crazy.
That's crazy.
You don't care enough about yourself to want to protect yourself because of something that's a misconception in your mind or some false belief that you want to hold on to. It's just like, we'll talk about, again, what I talked about earlier. Men, it's a false belief to believe that it's okay to cheat on your family, to cheat on your wife, your girlfriend. That's a misconception. That's another conversation. But, that's, and in a similar way, it's a misconception to think that if I don't have to get this the vaccine because I'm healthy, I'm cool right now. It's almost like saying, a lot of men won't try to change their unfaithful ways until they're caught.
Right.
Well, in a sense, that might be too late.
Right.
Try to change that before that happens,
Right,
so
right.
that you can prevent that, is what I'm talking about with relationships. But in a similar manner with the COVID, and we see this time and time on television, the story you just mentioned. Someone who wasn't vaccinated, they catch the virus and they infect themselves, their friends, their families, your workers or something, and then it becomes tragic.
Right.
And then it's too late. Well, look, the good news is that if you would just do it because it's the right thing to do, it's not going to hurt you. All of the folks that have taken this vaccine, I've taken mine since early January and February. I'm still here. I'm healthy as an ox. I'll probably be more healthier than most people. But that's to say that nothing's happened to me. Any myth you have about taking it, and for me, the worst after effect would have been that I couldn't sleep on the arm that I got the vaccine on. I couldn't roll over on it, right? So I slept on my back for a day. But that's a small inconvenience for being able to live and to make sure that my family is safe.
Arm pain is a common thing that I hear. A few people actually kind of got a little flu symptoms, right? But that's a very few. So, but I want to ask you a question. So you mentioned that you after you read and learned about it, where did you get your information from? Where were you getting that information to kind of get you to the decision that it was okay to take it? What were your sources?
Okay. Well, a lot of my sources were the experts that were coming on TV.
Yeah.
And then also, and they challenge you to go to CDC. Center for Disease Control. So I went there and I read, and then
Right.
I read again. And I read. We have, the internet is our great library. So
Right.
I read. I read. Our church was blessed to have a nurse, someone who worked in a hospital situation, come talk to us. One service on the
Oh, good.
Zoom, and educated us and told us things that we should do. This was even before, I think, before the virus. I mean, before the vaccine was available. But they told us about how to social distance, how to do this, that, and the other, how to manipulate and live healthily through it. But when the vaccines came available, also, I think we also had someone else come to speak to us about the vaccines so that everyone can approach it from a point of view of knowledge and
Right.
education. See, this is not, and as you know, Dr. Lenore, this is not a matter of opinion of I think this or I don't think this. This is not, this is really cut and dry facts.
Yeah.
That had taken it is going to save you. And it's going to open, and it's like you said, it's going to open up the country sooner so that we can get back to normal. But tell you the truth, right now, in my mind, this has become the story of the haves and the have-nots. Those who have the vaccine and those who have not. Now, the ones who have the vaccine, we're at a much better advantage rate for living as normal of a life as we can now, and knowing that we have a source of protection that, even if we do get this, we can fight this off, and our chances of living are far greater. And those that do not have it, well, you're becoming a sore thumb. You're becoming a cause of the numbers going up now. You're
Right.
becoming a cause of, let's say this, in my industry. Lenore, I've got a show coming up in Chicago in October where I got to take musicians across the country. And so I remember maybe a couple of months ago. In fact, this is a show that was a pre-show record was booked, but we've had to change the dates over and over because of the COVID, right? So now we're on track, and if everything goes well, point is I'm getting at is that earlier on I had talked to a couple of my bandmates, and two of them mentioned, you know what, I'm not getting the vaccine. I'm okay, and I'm not going to do it. And because I asked all my members, hey, look, who's got the vaccine? What are your thoughts about it? Tell me. Now, I haven't passed any judgment on anybody. I just needed to know. But as of today and next week, once I start booking these tickets, I'm going to come back to my musicians, and particularly the ones who said they weren't going to do it, and find out where they're at. But the truth of the matter is, if I have any musicians that I can hire, give a job to, an opportunity to, and they're not vaccinated, I'm not going to take them, because it's one less thing for me to think about.
Yeah, you
I
have
don't want to
one
have
less
to
thing for you to worry about. Yeah.
exactly. I don't want to have to think, am I going to catch anything? Is any of the members going to catch anything?
Yeah.
We have to, as we travel and we go to this city to do a show, we're going to be our own village and our own bubble.
Yep.
But we're going to hang together, because this virus thing, we got to be conscious enough not to bring that back into what we're doing. But
Exactly.
then what I'm trying to say is that it's going to cost some people some work, and it's a nice job. It's a nice paying job for a musician. I don't pay cheap, okay?
Yeah, I got you. A brother man can make a little pennies.
Exactly. And you know what? You know what's so interesting about the musicians that I know and the people in the art is that, look, that's one sector that's been greatly affected, adversely
Huge.
affected
Huge.
because of COVID. Look, all of our, if you were a performer, everything was shut down.
Everything.
So if that's all you did, you've been in trouble.
That's right.
That's another story.
That's another
So
story.
it would behoove you as we go into our work to not let that be a hindrance.
Right.
Don't let
Exactly.
your stubbornness or your inaccurate thinking or rationale prevent you from earning a living.
Yeah.
And as we know too, we're hearing in the news that so many cities now are requiring by a certain date you have to be vaccinated or you can't come back to work.
No, this is serious
So
business, and Black folks need to work. And so
Yes.
for you to mess up your cheddar, I don't know what they call it, whatever it is, for you to mess your dollars up, and listen, musicians, people who drive Uber, Lyft, all of those people, the gig economy,
The gig community, right?
you didn't get no PPP loan because you had to be able to get a PPP loan. You had to show W-2s, and you had to show that you had to have your taxes, and and a lot of in your profession, some of them don't have a whole lot of that. So they've been struggling. I can guarantee you for the last 6 to 9 months, and so now we're ready to get back. And you can't do no performance. Kevin, how you gonna do a performance and social distance 6 feet and wear a mask? That's ridiculous. So everybody needs to be vaccinated. It's just
Yeah. Let's come to the point. Everyone needs to do it. And again, I'm using my industry, the entertainment, the musician, the gig community, performers, as an example of many communities of work that is going to affect you. That you have to do that.
yeah.
I personally, I don't argue with folks. I like to, like for instance, I have workers that may come in my house to do work, and the first thing I have to ask them, are they vaccinated? And if I try to ask the company beforehand, but sometimes I had one worker the other week coming here, no mask. He got to my door. I asked him, was he vaccinated? And he said no. Well, I said, you got to get your mask on. And let me show you another way that you're going to enter the house. You're not going to enter the main area, right?
Right.
So so that's a case where here's a guy who works. His company obviously doesn't mandate that, but I had to call. Well, let's put it this way: I'm reminded that I'm going to call his company that he worked for and tell them of the incident because they should know that put us at a level of uncomfortness
Right.
that I wouldn't call that company again
Right.
until they have kind of mandate that they not only should they be vaccinated, but they tell your workers they should wear masks. This ain't no joke. You just come into somebody's house.
Yeah.
You can jack us up.
Yes,
we
right.
can get sick.
And
And I don't want that.
People need to know on the audience that you're in Cali, you're in Los Angeles. Los Angeles
Yes.
is struggling, okay, with
Yeah.
so many
Yeah.
of the young people not wearing masks, going to bars, gathered in their homes. This Delta variant is serious in LA. And you're looking
It is
at
very
98% of your hospitalizations are unvaccinated people. 98%. This medical moment is brought to you by Total Lifestyle Change. Should I get the COVID-19 vaccine? The answer is yes, you should. Over 600,000 people in the United States have died of COVID-19 since 2020. This is not a myth. This number is for real. If you're an African American with diabetes, heart disease, obesity, or other conditions that affect the immune system, you're at a much greater risk of suffering the bad effects of COVID-19. The Delta variant is here in Georgia. Only 38% of the people in Georgia have been vaccinated. This needs to be 80%. The Delta variant is more contagious. Most of the hospitalizations we're seeing now are in unvaccinated people. You're in control of your destiny. You can protect your family and friends by getting the vaccine. For more information on where to get your free vaccination, go to vaccines.gov. If you have any questions about the safety of the vaccine, call Total Lifestyle Change at 800-788-0941. This medical moment has been brought to you by Total Lifestyle Change. For more information about COVID-19 and other chronic conditions, visit us at tlc-global.org. Remember, knowledge is power.
It's so true. I can share another story with you. This week, I was blessed to have go to the lot of Paramount to work, do a sideline musician gig. I'm the pianist in it's going to be a big movie. I can't tell you anything about it, but it's a big budget movie. But the point of it is this. In this 1 week, I had to be, and I already had the vaccine. On Tuesday, I had to come in for a fitting, and that Monday morning, they called me and said, you need to go get a test. just to come in. I said, I'm vaccinated. Nope, go get a test. So then when I come in Tuesday and I do the fitting, I get another message saying, okay, the shooting is on Thursday and Friday. That test is not good enough to hold you for the end of the week. Give me another test on Tuesday. Okay, so I gave him a test on Tuesday. I get there on Thursday, and when I got there on Thursday, that was cool. Then Friday morning, just yesterday, they had us take a test when we came for our fitting. I mean, not for our fitting, but to get dressed. That's a whole 2-hour process. They had, with a 15-minute test, a swab test. So I'm saying even these big companies aren't playing around. So not only do I have to take these tests, but Lenore, look, getting into the building, the Paramount studios, and they got thousands of people coming in there day by day. They require you to show, they have a form for their business that you have to fill out after 12 o'clock every day to show that, it's a questionnaire. To ask, have you been, infected with the disease? Have you been with anybody within the last 72 hours? You have to fill this out, and then when you get to the gate, you have to show that email that you have filled that out and that's accurate.
Yep.
So it's a number of checkpoints. And throughout the whole process of filming, and we have yesterday was a 16-hour day. We're on stage, and when we're not performing on our instrument, now I'm a pianist, so I don't have to blow into anything. But, the horn players have to take their masks off, and obviously they don't want to film us with their masks. Right. But when we're not being filmed, everybody has to have on the mask. All the crew had on the mask all the time.
Wow.
Even taking those tests, and if you weren't vaccinated. So I'm telling you this story because the work community is tightening up.
Oh yeah, they
and
are.
If you still a hanger on to, hey, I don't want to get vaccinated because of this, that, and the other, it's going to start hurting you, and it would be unfortunate that out of ignorance,
right,
and being stubborn, and wanting to just fictitiously think about stuff, and believe fake news that you're going to be affected in a bad way. Not only can you get sick, okay, and die, but you're going to be cut out of work.
Yeah,
it's
crazy.
So is this really worth it to you to do all these things? Then if you cut out of work, then you're affecting your income, your family's income. See, it's a whole chain of reaction of things.
Right.
It's kind of like infidelity. Right. One thing starts right. Being unfaithful, it's a whole snowballing effect that affects everything. Not only your family, your wife, your children, your friends. It's just snowballs and snowballs.
Right.
And where does it go? It goes to a very bad place unless you take care of it.
Right, exactly.
Unless you take care of it and turn that around, turn your thinking around.
Right, exactly.
You can, just like a broken marriage can be healed and saved. I'm an example of that. That's my story. Someone who has not got the vaccine,
right, can fix that tomorrow. Actually, they can fix it today. It's because it's free, right? So let me just tell you some of the things that I've been focusing on, and I've been trying to get out there on my Instagram and my Facebook. So let me just kind of go through just 3 or 4 of the things that I hear. Number one, that they don't believe that the virus is real. And it's absolutely real, folks. And if you don't know that, then I know you know somebody who works in a hospital where you live, and just ask them about what's going on in the ICU and in the emergency room. Just ask them. And they're going to tell you that people are coming in there unvaccinated, and these people are sick. And what I mean by sick is they cannot breathe. I don't know if you've ever not been able to catch your breath, but it's serious when you cannot breathe. And these people can't talk, they can't breathe. And let me tell you the other issue. This thing is rapid. So when you walk into that emergency room, 24, 48 hours later, you might be on a ventilator, and another 24, 48 hours, you're done, you're gone. So it was so rapid. The families couldn't even, they couldn't even adjust because this thing was so rapid from the time that patient presented at the emergency room, because usually they delayed going, to the time that they were no longer here. So this thing is serious. Number two, there's this issue about it's not approved by the FDA yet. Okay, listen. The fact that they had I watched the FDA hearings. They were all day long. I actually sat there and listened and looked at the scientific data that was presented on Zoom by these scientists. I'm a pharmacist. I understand how the pharmacy works, how drugs coming to the market works. That's what I do for a living, is I participated in clinical trials. And no drug is allowed to be in the marketplace in this country unless it's gone through a huge, huge amount of studies, scientific rigor, etc. So you can trust. I watched it. You probably didn't watch it. I watched the FDA hearings. We saw the data. But then, being a skeptic, because I'm a skeptic, because I know that there have been some drugs that hit the market that weren't good and had to be pulled off the market. So I then called all of my doctors and friends that I know, my cardiologists, my hospitalists, my ER doctors, my immunologists. I called everybody that I knew, my allergists, to ask them, what did they think? And they all were also watching that day. And they saw the data for themselves. So this thing is, the 3 vaccines that are on the market are effective. There's no doubt that they're effective. So please throw that question out of your mind. If you're worried about safety, they are safe thus far. Millions of people have taken them. A few people have had some problems, but a few people have problems with any drug. A tablet, injection, suppository, no drugs are 100% safe. The fact that you tell me, well, I'm not sure what's in it. Well, hey, Kevin, you remember when they were doing the B12 shots for weight loss and Fin and that whole thing? And all them folks were going to the weight loss clinic to lose like 50 pounds? They didn't ask them, what's in this shot you giving me? They pulled their pants down and got that shot. So my point is that if you're going to question medicines, then you need to question all the medicines. So for the brothers out there, got a little burning on urination, and they think they might got a little syphilis or gonorrhea, be sure you don't take that shot. Because you don't know what's in that shot, do you? No, but you're going to go take that shot. Yes, Kevin? They're going to take that shot, right?
Yes, absolutely.
Okay.
You know, I'm glad you're mentioning those things from a scientific, clinical point of view, because that's what we should really be thinking about. See, this is beyond emotional content or trust or not. This isn't anything against people of color or the Black community. Most of the stories I'm hearing from people are that, I don't need to do it because I'm okay. I'm okay. I'm healthy. I take vitamin C's, or I take some things that I'm okay. And this is even people. I was talking to a young man, former student of mine, who came to do some work with me just the other day, and I asked him about the vaccine. He said, I'm not against the vaccine. I just haven't taken it yet. I said, well, what are you waiting on? He said, you got a wife and 2 young kids. And his wife travels, and I just said to myself, you're really putting yourself and your family at risk, but I'm not here to preach to you. Just come on in and bring your mask. We'll work with that.
Well, listen, if you don't want to take the vaccine, no problem, but you have to get tested. You got to know if you at least have it in your body. There were a whole hundreds of thousands of people last year who were asymptomatic carriers. So they were carrying the virus and they were spreading the virus, but they didn't get sick. Now, let me tell you what's deep about this. And everybody's seen the movie Alien. Okay, so that's what this is about. So you got this virus in you. You don't even know if you got it because you haven't been tested. So it's in your body, and you're young and you're healthy and you're strong, and you didn't get sick last year. So now this Delta variant is inside your body, and it's mutating, and it's growing, and it's learning your immune system because you're strong and healthy and your immune system fought it off. That virus's job is to change and morph, just like alien, change and morph and grow. So when you then breathe it out, it's a different virus than when you got it. So you became an incubator. You became the petri dish to help this virus get stronger and more deadly and more contagious. So the young people who are healthy at least need to get tested. And if you're COVID positive, whether you're sick or not, you got to shut that thing down. So you need to get, once you get, you go through so many days or whatever where you're quarantined and now you're negative, you need to take that vaccine immediately because you don't want to grow this new virus. So it's really important.
Yes, it really is important to get this news out and network out. This is going to be available as a podcast, is that correct, Doctor?
Yeah. So this is up on my website, but we're recording this. We're going to send this to you. I want you to please send it to your Facebook and your Instagram and everybody out there. It'll be a link. It'll be a link. And it's up on my YouTube channel as well, Healing Our Village. You just type that in. We have a little COVID conversations folder. So we got to get the word out, especially if you got relatives in Louisiana, Tennessee, Mississippi, Alabama, Arkansas, Georgia. Can you send out Georgia first, please? Because I live in Georgia. I need to get everybody to 80% vaccinated where I live, please. I'm sorry, it's selfish. I don't care. I need to get Georgia. We're only in the high 30s. We're only in the high 30s, people.
That's not good. You know what? That is not good enough. And and like you mentioned, Doctor, that yes, you have to continually test yourself. And I've had friends who tell me, I get tested, so I'm okay. A lot of people are saying, if I get tested and I show up negative, I'm okay. They're just okay. See, to me, that's not enough just for you to, that's part of it. But you've got to take the next step because you still, in between those times of being tested, you still have the opportunity to catch it and to get it. And so you're just, it's like you're playing Russian roulette with yourself because, unfortunately, one of those times the COVID bullet might get you. And we don't want another story and another statistic and another regret and remorseful saying, oh, I wish I should have done it. And then it becomes too late. Save us from doing that,
Right.
We can't. One other aspect I want to bring into it, and to me it's important, and it all depends on your degree of faith. I think from a faith point of view that God is really, this is a big test. I think this is a great leveler. And God has presented this thing all over the world. Ain't nobody exempt. And to me, it's a leveler and it's an opportunity spiritually for us to reset, to rethink, so that when we come out of this, I believe in our faith. We're not supposed to be the same. We're not supposed to be the same spiritually as well as health-wise.
Right.
God has given us another chance to reset our values. Love one another, be at peace, we have more in common than we do the differences. Right. What we have in common now is that the world is joining together, should be, to heal, to get this virus.
Right.
If we can do that, can't we do more?
Right.
Can't we be a better world, a better society? Because we have something to live for. I mean, the fatalities of this are staggering.
Right.
Let's talk about that over 600, I forgot what the count is, we're probably nearing 1 million or 700,000 deaths in the United States, or I'm not sure what the number is, but it's big.
We're mid 600s. Yeah, 650. I mean, it's up there.
That many people dead in a year.
And that's the one they can track. There were other people who died that didn't get reported as COVID.
Yes,
So it's
exactly.
probably a million.
So those numbers they're not made up numbers.
No.
They're not made up reason that, oh, this is COVID. See, that's a fact. But back to the spiritual thing, I think it's an opportunity for us to reset, to rethink, and get on track with what your spiritual mission is. And
Right.
if you don't know, God has given us time for you to reassess it and think
Right.
about it.
Exactly.
Wherever you need to be at,
Yeah.
wherever your faith is.
Right.
Um,
You know, one of the
Reset that.
things that's funny is I've had actually a couple of preachers tell me that didn't want to take the vaccine because they feel that the Lord has taken away his ability to do the healing or protect them, and so they didn't want to take the vaccine for that reason. And let me tell you why that's not biblical. Now, I didn't have this conversation with the pastors because I'm not a pastor, but I am somebody who reads my Bible. And let me tell you what the
Okay, for
problem
sure.
with that is, okay? So, Jesus, when he healed the blind man, and if y'all don't know the story, you need to read it. When he healed the blind man, what he did was he spit and he got some dirt and put it on the man's eyes.
True.
And then he
Yes,
told the
yes.
man to go to a particular body of water and wash it off. Now, did he have to go through all them changes? No, he did not. When he called Lazarus, he just said, come on out. Okay? He can just wave his hand and make fish and bread enough to feed the multitude. The woman just
Yes.
touched the bottom of his robe and got healed from the issue of blood. But in this case, he had to put together a little something, something to put on the man's eyes and then told that man to go and do a certain thing. That's what this vaccine is. Now, a lot of people don't know that one of the vaccines was actually developed by a black woman. Her name is Kizzy. They call her Kizzy. She's at the NIH. You can count the number of scientists in the virology area of the NIH on one hand. When that virus was the DNA sequencing of that thing, right, came out
Yes.
from China on Friday, she had figured that vaccine out by Monday. So this whole thing about, well, it takes years to develop a vaccine. You don't know that. These folks have been working on these SARS viruses for years. And they were able to
correct.
change it to meet the need for this particular SARS-CoV-2, right? SARS-CoV-2, they were able to change it just as soon as they got the sequence. So this idea that it got here too fast, it got here, that's crazy. Guys, listen, if you have questions that are legitimate, please call Heal in Our Village, 800-788-0941. Please go up to my website, HOVhealth.com. Listen to these beautiful videos that we're doing from the experts. I have ones up there from pediatricians, from pharmacists, from doctors, all talking about that this thing is something that everyone needs to get vaccinated. I tell folks today on my show, when you go to work on Monday, tell your boss you're going to be late on Tuesday because you're going to go get the vaccine. And you come back with your little card, and he ain't gonna dock no hours from you. Trust me, because he's glad that you went out there and got vaccinated. So do it. It's free. I've never seen people don't want to take that free. Kevin, who doesn't want something that doesn't cost any money? Do you know how much the government paid billions and billions of dollars?
And you know what else is crazy out here in California, and other places too. The governments, we had a lottery here. They paid people hundreds of thousands of dollars just to get the vaccine, or they paid them thousands of dollars. And you know what? That still isn't enough. And what does it take? What does it take really to get someone who's on the fence, to do this? Because the other element that we talked about, well, I guess we kind of talked about it. It's a sign of being irresponsible.
Yeah,
and for something that you don't need to be irresponsible for. You can be responsible for this, and it's okay. It's just okay to do it. Just, do it. Do it because it affects other people.
Yeah, I think now it's sort of like not to cut you off, but you know, it's sort of now it's in vogue not to take it, you know, because now you have a conversation that you couldn't have before, right? So now a lot of people are not taking it because, well, I want to be that, you know, the dissident. I want to be this person that's different than everybody else. This is not the time to do that, folks. But go buy you a new outfit, get you some new shoes, do something else to separate yourself, not the vaccination.
Right, exactly. No, we have to do it, and the truth of it is this: if you don't do it, you could be another statistic. I mean, and the you could part, the percentage of that happening is greatly. So don't do it to yourself. Don't do it to your family. Don't do it to your community. It doesn't have to be this way.
Exactly, exactly. Well, I'm going to
just doesn't
send you
have.
this video. You're going to promise
Yes,
me to get it out, yes?
I
If you
will.
know
Yes.
anybody who wants to come, who didn't take it, and they want to have a conversation with Coleman about, you know, why they didn't do it, I'd love to have them on the show, because we're going to be doing this every Saturday for your health. It's about COVID conversations. And I really need to get all of that up. I have a survey that I'm going to send to you as soon as it's finished for you to send out so I can get some more information in about why people are not taking it. So I can message to that. You're going to be here. I talked to KGLH on the yesterday. So we're going to get
Okay,
some
great.
PSAs. You're going to hear my voice, right? So you let
I
folks know
love it.
that's
I love it.
Coleman.
And I love the fact that you mentioned that. Okay, if I can get some people who have not taken it to speak, I think that would be so important.
Yeah.
Let them talk, and because the conversations need to be had, and
Yes.
hopefully they can be done in a way that's not confrontational, just about the
No.
facts,
No.
to try to come up to the understanding as to why is your position this way,
Yes.
and what's at stake for that.
Yeah. And
Uh,
listen, they can come on the show as long as they live in a blue sky world. Now, see, I can't have nobody on the show that lives in a purple sky world. See, because I live in a blue sky world. You see what I'm saying? So when I walk out my door and the sky is blue, if they walk out their door and the sky is purple, see, I can't do nothing with that. See, I can't. Okay. So they got to believe that fat meat's greasy, because when you get the fat meat and you put it on a napkin and you lift up the fat meat, there's a grease on the napkin. So they got to believe fat meat's greasy. But
Yes.
if they believe those things and they live in a blue sky world, I'd love to have them come on the show and talk to me.
And look, yes, and look, let me just mention something else. I want to just plug you and what you're doing with your work. I have been a part of your pre-diabetes class since February, the start of February, and it's been a great teaching tool for me. I'm losing a lot of pounds, probably lost at least about 15 pounds.
Wow.
My diet has changed, and the lifestyle changing teaching that you give us and your instructors have been really good. And of course, I'm continuing. I still have another 6 months on it, but I want to thank you and your team for doing a terrific job with that class. And there should be that class should be. We're on a Zoom, and we got 7, 8 people. That Zoom should be. We should be having hundreds of people on that Zoom. There should be a line of people waiting for that. People that have pre-diabetes or diabetes, don't fool yourself about that. But there are ways that you can improve on it. And if you're pre-diabetic, like I was, hey, there's a road to you perhaps not even being diabetic. Right now, my numbers came like 2 months into the class, and I was out of the pre-diabetic range. Now I have to ongoingly keep this going. I can't say hurrah, 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 and then go back to the old way and get back into it.
Right.
But your class is giving me and my classmate a pathway to a healthier life to beat that.
Yep.
And
Step Up 90 is the name of it. Step Up 90. Thanks for the plug. StepUp90.com.
Yes.
And we're about to. In fact, you're going to get the app. We got an app now, so we're going to get the app on the phone, and it's going to. You can be able to watch this whole thing on your cell phone, which is real cool.
Yes.
So for those who are interested in finding more about that, StepUp90.com. Our 800 number is 800-788-0941. We would love you to be one of our first people to come on board with the app. You heard the man. I didn't ask him to plug it, okay? He has lost
No,
15
absolutely.
pounds, but the most important thing he said is his numbers went back to normal numbers in terms of diabetes. And that's what the data shows. The data shows that a third of the people, if they just pay a little bit of attention, can go from pre-diabetes back to normal glucose tolerance. That's a big deal. It's a big deal. And so I thank you for that. I appreciate you. We're going to be hanging out for another 6 months on this program. And
I look forward to it.
yeah, it's going to be good. Thank
And
you
then, look,
so
I just
much
want to
for
mention,
today, too. I appreciate it.
well, I appreciate you having me come on it because it's an important conversation to have with just a layperson. You know, I'm a layperson. I'm not a doctor. I'm not anybody in the medical profession. But it's important to hear my perspective
Right.
and other people's perspective because it's so important. I do want to mention this though too before we leave that I want to encourage people to visit my website www.kevintoney.com. Not only for my music but for my greater purpose. You know, even though people know me for my music and it's been such a blessing, my greater purpose is simply this: to help families stay together through faithfulness in relationships.
Yep.
That is my mission, and my music just positions me to do that.
Right.
God has blessed me with all the success to ultimately do that.
Right.
And it's important that we all find our purpose. That is my purpose, and I've got books and tools that if you need that information, they are available on my website to help you with your relationships, to help you be faithful, to help you get in relationship training.
Right.
I got to share one quick thing that at the top of the year, I'm going to launch a new book
Okay.
called
Good.
Winning the Big Game, Relationship Skills for Men. And it's just what it is, winning the big game, you know. And so my analogy is that as you train, as an athlete trains to win the big game, whether it's in basketball, football, baseball, or whatever, they have to train. And those guys and gals are winners because they train, they practice, they train, they practice, they train, they practice. We as men can win in our relationships with our wives, our girlfriends, our dating partners, if we practice and train and practice and train the skills of relationships. There are skills
Right.
that we can learn to win that game. And so that's really what my new book will focus on. It'll be a workbook, and it'll be a book to change your life.
I love it. I love it.
And
I
so I'm
love
looking
it. I
forward to
love
that.
it. All right,
Yes.
so we will have you back. Keep your ear to the ground out there for me, and
I
continue
will.
to spread the word. That we need to get this COVID conversation out to as many people as possible. Please go get Please go get tested. Please go get vaccinated. This is so important for our community more than anybody, because the reality is, if you look at the deaths of African Americans last year that make up this 600,000 plus, we died at 2 to 5 times higher rates, and we died because of our diabetes, hypertension, and our obesity. And we add the worst sequelae of the COVID if we get it. So this is more important for us folks than it is for anybody else. So help me heal the village, spread the word. If there's any questions, we're here for you. 800-788-0941. Thanks, Kevin, and we'll be talking. This medical moment is brought to you by Total Lifestyle Change. Should I get the COVID-19 vaccine? The answer is yes, you should. Over 600,000 people in the United States have died of COVID-19 since 2020. This is not a myth. This number is for real. If you're an African American with diabetes, heart disease, obesity, or other conditions that affect the immune system, you're at a much greater risk of suffering the bad effects of COVID-19. The Delta variant is here in Georgia. Only 38% of the people in Georgia have been vaccinated. This needs to be 80%. The Delta variant is more contagious. Most of the hospitalizations we're seeing now are in unvaccinated people. You're in control of your destiny. You can protect your family and friends by getting the vaccine. For more information on where to get your free vaccination, go to vaccines.gov. If you have any questions about the safety of the vaccine, call Total Lifestyle Change at 800-788-0941. This medical moment has been brought to you by Total Lifestyle Change. For more information about COVID-19 and other chronic conditions, visit us at tlc-global.org. Remember, knowledge is power.